Good afternoon, Dr. Sharma, and welcome again to another session on mental health.
And good afternoon to you, Dr. Vasconcelos. And good to be back with you.
Doc, today is October the 6th, 2020. And as we continue our series on emotional disorders, can you share with us a little bit on depression?
Yeah, so we're going to talk some more about depression in terms of the clinical signs and how it presents in a number of ways. It can be a complication of medical problems. It could even be a reaction to stress from the environment or medication that people use and diseases that they may have in their system. But today I want as an introduction to more talk of it in terms of how we should look at depression. And many a times people have this attitude, negative attitude towards emotional disorders, including depression, which makes people who suffer with these conditions, anxiety disorders and depression, feel somewhat embarrassed that they have it, and they feel, well, I shouldn't have this condition. It's sort of like I was brought up well. Why do I have the depression? And people look down at me if I say I'm depressed. I see that when I see patients with depression, and you got to put them on a medical leave, and they say, "Doc, what are you going to write on that medical?" I said, "That you have a depression." I said, "No, no, no. Can you please put something else?" I said, "Well, what do you prefer?" I said, "Well, can you make it like a medical condition?" Um, like what? I said, "Well, maybe a headache. Can you put headache?" I said, "Well, no, but depression is a medical condition, and it's one of the most significant medical disorders in a person's brain." "Well, what do you think it is?" I said, "Well, no, it's a weakness of my mind," or they'll say it's an emotional problem. So emotional problems are medical conditions, and they are biological in nature, and whether it's a reaction to the environmental stress, it certainly is a physical distress from your brain. So that's the kind of attitude that's out there. So I wanted to address that today as we move forward into looking at depression from a clinical point of view. That depression is a biological disorder of the brain. When it happens, the brain is starting to change in the way its neurochemical function operates usually, and it's going to get lower in its serotonin levels. There are going to be changes in the brain electrical activity. So those two big aspects of good brain health are going to change because the mood changes, because the mood center now is affected in a negative fashion. So that's where I would really wish that people start to see depression as a medical illness, as an illness of the brain, as much as somebody may have a lump in their breast, a cancer that is going to destroy the tissues and try to invade that person's healthy body and eventually destroy them. And that's exactly what depression is doing. It's a cancer of the brain that is going to permeate the whole brain, and the whole body will become weaker. And eventually, the goal of, or the end result of a depression is to end a person's life. And the end result is by suicide, because as people get more and more depressed, they start to feel hopeless, the sense of worthlessness is very high. And unfortunately, with it comes this dreadful thought of life is not worth living anymore. There's no joy. So it takes away from life. And if we think of the medical model of disease, when people have a cancer, that's exactly what happens. It's going to erode that person's health. The immune system will go down, and they're going to eventually become weak and die. And the attitude that people have for persons with a medical condition like a cancer is much different to people when they have a depression. There's always this talk, or many times you hear, "Oh, get out of your bad state, you can pull out yourself from it." But we don't hear that with cancer. Everybody is very sympathetic and supportive and saying, well, nobody's jumping on the person now and saying, well, pull yourself together and move forward and see the light of life. That person with the cancer wants to see the light of the life. And there's a lot of sympathy and support. So it's an attitude. If people can see a depression in the same way as they see a cancer invading the person's health, body, where it's coming from, then they will have a different attitude to the sufferers of depression. And the persons with depression will not feel so bad about themselves as if they are mentally weak, which, as you know, makes no sense. But many a times we use those old words that are not sensible, and it makes a bigger problem for the person because if they're starting to think of themselves as mentally weak or not fit for society, it promotes a suicidal sort of thinking, and truly that's a tragedy of this cancer of the brain called depression. So that's my take on it, Doc, today. That we have to support, we have to understand, we have to care in a very healthy way, the same way we will care for persons with a physical illness that many people understand very quickly as a physical illness. They must also understand that the brain is a physical organ that is changing in its neurochemical function, in its electrical function, and its immune functions are going to affect the entire body. And we're going to see an end result of the person the same way a person has a cancer of the body, which can be cured, can be treated enough ended with dying in the same way a person with depression, that cancer is going to destroy them, it destroys the spirit of the individual. It's the worst disease on earth. I'm saying, Mark, that this is a terrible illness and it's not something to be looked at in negative light, not to look at, trivialize a person's emotional feelings, minimize their feelings. It's important for us to see the truth, know that this is a terrible, terrible biological disease of the brain that can be treated, that can be recovered. And we got to help those people find the right attitude, find the right words, and find the right treatment. That's the way I see it.
Doc, that is so true. I think we all can relate to depression, and I think we all know someone who has actually taken their lives via suicide. And so the question would be, what is the best approach in dealing with this disorder?
I think it's got to be from the time we know children are developing and starting to understand themselves, that we let them understand that their emotional health is as important as their physical health. We should be talking to young people about emotions and not to let them feel embarrassed about sharing their feelings and keeping it inside and holding those hurts and thoughts that are hurtful to themselves, and letting them know there's absolutely nothing to be embarrassed about, and depression can happen to anyone, and it erodes the spirit. I mean, I see persons who come and tell me, I would prefer anything but to be given drugs for this depression, and then they're pushing away treatment that is absolutely vital for them. When they develop a cancer of the breast, they don't go to the doctor and say, well, don't give me any of your toxic medicines. The chemotherapy and the treatments we do for cancer of the body is pretty severe. It's very, very toxic. The medications that we produce now for the brain are very far advanced. The side effects are so low. Yet people are resistant to that type of treatment. Why? Because the approach that they have in themselves is bad. They have this sort of negative perception of their own brain function. An important part of the brain is our emotional system. So I think, to answer that question, how do we approach? We got to start to educate our young people, educate the people in society, educate through these programs that you are doing, educate our physicians, our colleagues, everyone to have a better attitude to people who have emotional disorders. We don't want to lose anybody through suicide. We don't want to lose anybody through cancer. And the same approach, the same support, the same care that we give for people with biological illnesses that are destroying their bodies, the same approach we must give to people with depression, which is destroying their brain function.
Well, Doc, thank you so much for your commitment as a mental health expert in educating people. You break down very complex matters in a very simplistic way. And so it's so important for people to know that there is help, they're not abnormal, they are dealing with an illness, and there is an approach in dealing with it. And it begins by getting help from people like yourself who understand this type of disorder. Thank you. May God bless you. And any final words?
Well, we're looking forward to you coming to Guyana. The airports are going to be open on October the 12th, I hear. So that's great news, and I look forward to you coming and spreading your joy to the communities of Guyana because we are in need of your support. Spirituality is part of us. Thank you. Yeah.
Thank you, Doc. God bless you. Looking forward to seeing you in Guyana. Stay safe.
Thank you.